Maybe I should say hola because I'm from Venezuela, from Caracas, Venezuela, although I
in Venezuela, could they hold the mic up to the chin?
Yes, right here? Okay. So trained in Venezuela as a physician, as a medical doctor, and then went to the US and did my surgery training in Michigan, and now I work in Maine. But I shouldn't even say hola, I should maybe say bonjour to the French audience. And I'm here to tell you about the M-Health applied to trauma. And when Denise first invited me, and I really appreciate the invitation, we had the thought of, wow, you know, this is good. It's a European, a global audience more than European. So I had an idea. And I thought, well, I'm a GoogleGlass explorer. I am a future med grad and GoogleGlass explorer after that. And I thought I could give this a different twist. And the name of my talk is iPod Teletrauma. It's how to use an iPod Touch device to use M-Health applied to acute trauma care. The $229, 130 million square foot trauma room. But before anything, my name is Rafael Grossman. I'm an active clinical trauma surgeon. That's my real life. This is my alter life, my other side, the passion about M-Health and technology and innovation in technology. And that's my Twitter hashtag, my Twitter handle. GoogleGlass, it's been in everyone's mind lately, and I thought that because we're in France, and French like to give a flavor to their things, I want to give a little GoogleGlass flavor to my iPod Teletrauma talk. So here it goes. So it goes M-Health applied to acute care trauma, going from a iPod or a smartphone to GoogleGlass. So trauma, it's a real problem. Trauma is a healthcare disaster. I really believe that trauma is a major problem that unless approached differently, it will become a major source of problem in healthcare. Trauma involves any sort of injury that can injure you. You know, you have some ugly pictures in there, but likely this is before lunch and not after lunch. But we have involved in the care of patients, involved in motor vehicle crashes, falls, gunshot wounds, and you name it. So trauma is the #1 cause of death and disability in folks between 1 and 44 years of age. So most of you might be, you know, facing trauma as a primary cause of problems for you soon. So trauma represents a major problem, like I said, in healthcare. And healthcare itself is in trouble. And I'm going to go over a few points to just give you tips on why I think that healthcare is really in trouble. First of all is the cost. $2.7 trillion. That was the expense related to healthcare in the U.S. in 1 year, the year 2009. And that's about almost 18% of the gross domestic product. And that's an old figure. This is now 4 years later. The other issue with trauma is related to time. So timing in trauma is very important. The time that you have between the actual trauma and the moment when you get the expert trauma care. There's a graphic in there, and the red points to the areas that have the longest travel times or the longest delay in time between the actual event and the actual care by an expert trauma team. And when that happens, mortality goes way, way up. So time is really important in trauma. The other problem is the deficit of doctors. As you know, doctors and especially specialty doctors, and especially in rural areas, are really a commodity. A deficit of doctors has been proposed that it's going to be greater than 100,000 doctors deficit in the year 2025. In the year 2015, the prediction, and it's approximate, that there'll be about 67,000 doctor deficit in the U.S. There's a high demand for services, and there's a short supply of the actual service. So that really, along with the fact that there's about 1 billion office visits to physicians' offices in 2011, makes this a perfect storm. And we know that about 80% of doctor visits do not require physical care. Obviously, it depends on the specialty, but we know that about 80% of doctor's visits really don't require you to be there with the doctor, don't require the doctor to physically touch you. So that is really, really a perfect storm. And that makes it feel perfect for mHealth. mHealth, mobile health. And you all know what that is, but I'm not talking about apps or acts. Acts, I call them accessories. The EKG that you can attach to your mobile device, or the stethoscope, or the otoscope, or the ophthalmoscope that you can. That's to me an act. So I'm not talking about that. I'm talking about virtual, synchronous, real-time audio-video communication. So we all know that it's been said a picture is worth 1,000 words. Well, I'm really a believer that a video is really worth a million pictures. So that brought us to telemedicine. So I work in Maine. So Maine is a pretty large state, pretty rural state in the U.S. The area that my hospital covers, it's about 2/3 north of the state of Maine, and that's an area larger than Massachusetts, Vermont, and New Hampshire together. And that's covered by just one hospital. That's covered by a group of 7 trauma surgeons, only one of us on call every night. So all that extension, all that geography, and many times in very inclement weather, because Maine has a pretty tough weather about 4 or 5 months of the year. The helicopter cannot even fly because of the weather. So that makes it a perfect territory for telemedicine. So we have been using telemedicine for many years. We have big equipment. These are actual pics of our trauma room. You see the camera up top, and the camera really can connect the referring providers to us when we are treating their patients. And before the patient arrives, we can actually look at the patient. They have the same setting in their trauma room, and we can see what they're doing, and we can remotely manage the camera. We can focus, zoom in, zoom out, talk to the physician, look at the patient. That requires all these large equipments that are expensive and that somewhat are in a way very hard to maintain. We have several stations. We go to the actual call room or to the conference room, and we sit down in one of the stations, log in, and call the actual requesting group, and then we can connect with them. So this all really is really interesting, and it makes a lot of sense.
All right, so make a call. We find our directory menu. We go to Blue Hill. Hit the little green button. It's really fairly straightforward.
That's one of our mobile units.
In a minute or so, we can actually see their trauma room. And they've got their mute turned off now, which is a nice thing. So in order to navigate, I can actually take control of their camera and move all around the room. I can zoom in.
We can stop the video now.
And zoom out.
Thanks. So that is really a step forward. But we've been doing that for a few years, and then it came devices that really were designed for play, and now we can use those devices to actually save lives. So we have portable devices like the iPod Touch, we have smartphones, we have tablets, and then as they evolved, then we evolved with the actual use for these devices. So we're all familiar with these devices. We're very keen on how to use them, but the idea behind using these devices to provide care, to prevent injury, to treat injured patients and save lives is really, I think, an innovation.
How are you?
I'm good, thank you very much. I heard that you have a patient with a head trauma. How can I help you?
Yes, Fletcher was hit in the head with a baseball. He was a little bit dazed, and I just was wondering if you could check his eye movements for me.
Absolutely. Hi, Fletcher.
Hello?
How are you feeling?
Okay.
Well, I'm going to check your eye movements real quick, okay? I'm just, don't move your head, just move your eye, okay? Dr. Hand will give me a good close-up. Great. How about you look up, look down, look left, and right? So that's sort of an edited version of how we use these mobile devices. We're not using the iPod anymore, we're just using smartphones. And from the smartphone, we can actually connect any of the big systems that they have in any of our 16 hospitals telehealth network. So iPod teletrauma. And I gave a TEDx talk about this, so if you Google that word, you get to that TEDx talk that really goes more in detail on what the actual project is. But now GoogleGlass. So GoogleGlass has been around very shortly, and like I said, I'm a GoogleGlass explorer, and when GoogleGlass came out, I really thought that the potential for GoogleGlass to really be the next step up, you know, from iPods to smartphones, to tablets, to laptops, to now GoogleGlass being that device that allows us to perform mHealth. So this is a short video. We're going to cut, but please play it. For those of you who don't know GoogleGlass.
Okay, Glass, record a video.
This is it. We're on in 2 minutes.
Okay, Glass. Hang out with the Flying Club.
Google photos of tiger heads.
You ready? You ready?
Right there. Okay, Glass, take a picture.
So imagine all these situations in medicine, taking pictures, taking videos, communicating with providers, communicating with patients or with patients' relatives during an operation, operating on a kid and suddenly finding an inflamed appendix and taking a picture of that appendix and sending it to the parents in the waiting area. So really the potential, I think, is really only limited by our imagination. We can stop the video, please. This was given to me by Anai Betty, who's a producer, but in the operating room you can get the screens with, and we don't have audio for some reason, but...
Because the time is over?
Oh, is that it? Well, okay. I'll go over face recognition. And I think the evolution is really where the key is. You know, where we were sitting in front of PCs and then the mobile devices and then in glass. I think that's the natural evolution of the interaction between the computing device and humans. It's the idea behind the use of the technology that really matters. Technology is exponentially growing, but it's how we use the technology that allows us to perform better and better healthcare. Thank you very much.